Bipolar disorder, also known as manic depressive psychosis, is a disorder characterized by extreme mood swings and affects approximately 2.5% of the population. The 15 to 30 age range represents the time when bipolar disorder reaches its peak. What are the symptoms of bipolar disorder? Those suffering from bipolar disorder alternate two phases, or rather two periods, indicated with the name of manic episode and depressive episode. During the manic episode, the subject has an elevated, higher than normal mood and a sense of omnipotence. He may not feel the need to eat and sleep. He appears cheerful, euphoric, and full of energy. He is uninhibited and hyperactive. He may begin to obsess over a particular activity, such as writing a book, starting a sport, or engaging in multiple new projects. May engage in risky activities, such as investing, reckless driving, and overspending, but also develop an addiction to gambling and compulsive shopping. During the depressive episode, however, the subject presents a depressed and pessimistic state of mind. Sadness and despair take over. If before everything was achievable, now everything is impossible. He loses interest in the outside world and in activities he previously considered enjoyable. He feels lack of energy and difficulty concentrating. Develop ideas of death and negative thoughts. The time between episodes can be slow, but it can also be quick and sudden. People with bipolar disorder can also experience one of two phases. Sometimes, the phase transition in bipolarism is alternated with a period called the euthymic period or normal mood. The symptoms of the various episodes can last a week, but even longer, and in some cases, hospitalization is required. The symptoms of bipolar disorder have nothing to do with the normal ups and downs of mood that we all often deal with. Classification and diagnosis. First, however, let's see how some terms are defined in the DSM-5, that is, in the Statistical and Diagnostic Manual of Mental Disorders, in order to better understand how bipolar disorder is classified. The manic episode is a period of persistently high mood, lasting at least a week, or of any duration, if the intensity is such as to require hospitalization for the episode. The hypomanic episode, on the other hand, compared to the manic episode, must last at least 4 days, and the clinical conditions are not such as to require hospitalization. Major depressive episode is a single depressive episode of mild, moderate, or severe intensity, with or without psychotic symptoms, such as hallucinations and delusions, and must last for at least 2 weeks. The mixed episode satisfies both the criteria of the manic episode and those of the major depressive episode, and the symptoms must last for at least a week. Bipolar disorder comprises 3 different clinical conditions, which, while having many symptoms in common, differ in intensity and frequency. We can therefore classify bipolar disorder into 3 types. It is characterized by one or more manic or mixed episodes, usually accompanied by depressive episodes. Is characterized by at least one major depressive episode, alternating with at least one manic episode. It is characterized by frequent mood swings or by alternating hypomanic periods and periods of mild depression for at least 2 years, which however do not reach the intensity of the symptoms of bipolar disorder 2. In the next video, instead, we will go to see in detail what are the causes and how bipolar disorder is treated.